According to the Statistics Canada General Social Survey on Victimization completed in 2004, over 512,000 Canadians were victims of sexual assault in the previous 12 months. Over 95% of the victims are women. Of these, 9% were reported to police. We are the Ottawa Hospital Sexual Assault and Partner Abuse Care Program. We are experts in the medical, emotional, and forensic care of patients who have been victims of sexual assault and intimate partner violence. Our team of nurses, nurse practitioner, and physician medical director ensures that each patient receives world-class care and services that they choose. We are one of the 35 Ontario network of sexual assault and domestic violence treatment centers. The Ottawa program is one of the oldest, being created in 1994. Our program sees approximately 300 new patients a year who have been a victim of sexual assault or intimate partner violence. Of these, over 98% are women. We are located within the emergency department of the Ottawa Hospital Civic Campus, and as such have our specialized staff on site and available 24 hours a day, 7 days a week, 365 days a year. Our treatment area is in a private, secure, quiet location within the emergency room. Our patients can choose from a full spectrum of care options: medical, forensic, emotional and social support, as well as safety planning. We have a close working relationship with numerous community agencies who we refer our patients to for ongoing counseling. Previous research into the risk factors for sexual assault focused on college and university students, particularly those in sororities or fraternities. A major risk factor identified was drinking alcohol, which is common at group events or mass gatherings. No studies have ever looked at the risk factors for the public as a whole. Our grant from the Women's Xchange funded a study looking at the prevalence and risk factors for sexual assault at mass gatherings in Ottawa. Mass gatherings are commonly defined as events attended by a sufficient number of people to strain the planning and response resources of the host community. For our study, we defined these as any event where a group of people were together for a common purpose. We did not explicitly limit the size of the gatherings, as we wanted to include the most events over the course of a calendar year, 2013. In 2013, 205 new cases of sexual assault reported to the Ottawa Hospital Sexual Assault Partner Abuse Care Program. 25% of these sexual assaults occurred at mass gatherings. Approximately 98% of the sexual assault victims were women, with the average age of the assaulted patients being 25 in the mass gatherings group. The highest incidence of sexual assaults associated with mass gatherings were seen in January, July, September, and October. These assaults coincided with New Year's Eve, Canada Day, University Frosh Week, and Halloween celebrations. Patients attending mass gatherings reported consuming alcohol and drugs, losing consciousness, and suspected being drugged much more often than those in the control group. For patients presenting from mass gatherings, the assailant was only known to the victim 33% of the time. The medical care chosen by our patients was similar between both groups. Sexual assault evidence kits, also known as rape kits, were completed more often in mass gatherings patients, but were released to police less often than in the control group. A number of key agencies in Ottawa have been interested in the results of our study. We will be meeting with each of these agencies individually over the upcoming months to discuss our results and plan specific prevention strategies to keep women in Ottawa safe while they celebrate at mass gatherings. Funding from the Women's Xchange allowed us to hold a networking event at our center on May 22, 2014. This was a unique event in celebration of May as Sexual Assault Awareness Month, as it brought together many of our community partners, the Sexual Assault and Partner Abuse Care Program team, the Emergency Department team, and the Greater Ottawa Hospital staff. 60 people attended, with some of our partners making more formal presentations. All were there to share information, resources, and make connections to facilitate the prevention and care of sexually assaulted patients in Ottawa. Major thanks to the Ottawa Hospital Sexual Assault and Partner Abuse Care Program team, who provide world-class care to our patients who are victims of sexual and intimate partner violence. Finally, a large thank you to the Women's Xchange for providing the funding that made this study and the prevention strategies that follow it possible.